So it's my pleasure to introduce Charles Odiase, consultant pharmacist in primary care and diabetes. Hi, Charles.
Hi, Joe. Thanks for inviting me today.
Oh, it's brilliant to have you. You're going to tell us all about the effects of alcohol and how that can affect somebody who's living with diabetes. So, what would you say to somebody who's living with diabetes approaching this festive season and there is so much alcohol around? What sort of advice would you give?
Yeah, it's a very good question. I think it's one that we often miss out because, again, we do have a lot of festive seasons where alcohol intake is involved in. So Christmas is no different. However, I think the advice would be, yes, it's a recreational drink. You need to enjoy yourself. But there's some key things I think people need to be aware of just to help guide that decision, how much they drink or how long they drink for. So it's thinking about the idea of alcohol being a drug in itself. And I know it sounds a bit harsh, but it's important to highlight this because actually in pharmacy and in medicine, we use alcohol to treat poison conditions such as antifreeze conditions. So the concentration of the alcohol and the volume does matter, just the same way the dose of a drug matters in relation to side effects and harm. So when we think about alcohol, one of the things to think about is what benefit does it give us? We know alcohol is something we refer to as empty calories. The reason we refer to them as empty calories is that they lack any nutritional value. However, because they are calories, they do increase your weight. And obviously, an increase in weight gain does have an impact on your sugar level, and this have an impact on how you manage your diabetes. So it's very important that we're mindful about how much volume of alcohol we drink over the festive period. Basically asking yourself, how much weight do I want to get after Christmas? So being mindful of that is very, very important. And the percentage of the alcohol you drink is also important. I don't know, Joe, do you want us to talk about the kind of impact alcohol can have on our organs? Is that something we want to talk about?
Yeah, but I think that's a really fascinating way to look at this. That alcohol is a drug, because I think we forget that quite
Yes.
often, and also the concentration of the alcohol impacts the amount of effect and calories and so on that it will have. If you look at the back of tins, cans, bottles, it does actually tell you now as well, doesn't it?
Yeah,
And
so
then,
it gives you the percentages, yes.
yeah, and also how many units are
Hmm.
in that bottle can or whatever. So that's a way that people can sort of keep a track on things as well. So you were going to say the effects that it can have on our different organs.
Yeah, so it's quite important. And I think it's very important for people to be aware of what the impact of this alcohol drug can be on our organs. And I think the key one that often people refer to is our liver. The reason for this is that your liver sadly can't multitask like most people. So when you heavily drink, your liver prioritizes what it does for you. Your liver tries to manage your sugars in your blood, but it also tries to get rid of any toxin in your blood, which alcohol becomes one of them. So because it wants to look after you, your liver goes for the alcohol to get rid of the alcohol and leaves the glucose alone. So if you're on drugs, especially drugs like insulin producing drugs like your glycoside or insulin itself, or when you have type 1 diabetes, then you're at risk of having hypoglycemia because your liver isn't producing the sugar that's required to keep your sugar levels high and avoiding the hypoglycemia, which is often referred to as hypos. This sad reality of this as well is that this effect could last up to 24 hours even post drinking. And in the morning, your hypo symptoms could be similar to your hangover symptoms. So it's being very mindful of this, staying hydrated, making sure you're being hydrated, making sure you're having carbohydrate meals before you drink, and probably having a carbohydrate snack in between drinks. But most importantly, reducing the amount you drink and being mindful of how much you drink it.
Yeah, because you're asking your liver to do a lot, and
Mm.
it's more than your liver can actually tolerate. And so then it can produce hypoglycemia, and you said that's up to like a day later.
Mm.
So because some people do get that and then wonder where on earth that hypoglycemia, that low blood glucose, has come from. But it could be from the effect of the alcohol that they drank previously. And I
Very
know
correct.
sometimes also you can get a spike in your blood glucose at various periods after drinking as well, after having alcohol.
Yeah, and again, I think it's a bit of a tricky one when it comes to alcohol because often, as I said, alcohol is referred to as empty calories, and a lot of alcohols don't have carbohydrates in them. But there are very few types of alcohol that might have a little bit of carbohydrates in them. But even then, they don't actually help with the hypo symptoms because the rate at which they produce into the bloodstream is enough to combat the hypo risk in itself. So I think it's very, very important that regardless of what type of alcohol you drink, you are mindful of that risk of a hypo. And it's, as I said, it's not just your liver that's the problem. Also, you have what we refer to as your pancreas. So your pancreas is the organ that produces and helps produce that insulin into your bloodstream. If you heavily drink alcohol, you sort of irritate the pancreas and cause what we call an inflammation of the pancreas, which could also lead to very high sugar levels in your blood. So that in itself will make the management of diabetes very, very difficult. And as well, it could also irritate your liver, which will also lead to what we refer to as fatty liver disease, which also makes the management of your diabetes very difficult. So those two organs are the organs that suffer the most when you drink. So it's very, very important that you're mindful that if you want to manage your diabetes appropriately, if you want to avoid gaining weight over Christmas, that you're very, very measured when you think about how much you want to drink and what you are actually drinking.
That's really good advice. And the other organ it affects is your brain.
Mm,
So that may be part of the pleasure that you get from alcohol, that feeling of relaxation, but it also makes you less mindful, because mindful is the word that you've used quite often there, Charles.
mm,
Mindful of what you're drinking, mindful of how it's affecting you, mindful that you should be eating some carbohydrate with the alcohol that you're drinking. And so it impairs that, doesn't it? So
mm.
you may not be so aware of how much you're drinking and may then drink to excess.
Mm.
So the brain is the other organ I think that we have to be aware of, isn't it?
Most definitely, John. And that's one of the reasons why one of the advice we give is that when you go out, that you ensure that your friends and those around you are aware that you have diabetes. They're also aware where you've kept your treatment for your hypos. They're also aware of what the signs and symptoms of hypoglycemia is and how to treat it. This is very vital for your safety because it is the reason why we are very concerned about hypos, that could have an impact on your heart as well and cause irregular transmission in your heart, which could actually create an acute or incident of a heart problem. As Joan has already said, it also depresses your brain as well. So that has an issue on how you control what you do and how risky you become over the night or during the day. So it's very important that people around you are aware and they know where your items are for managing it and how to manage hypos and how to recognize it.
Yeah. So, you know, alcohol is part of enjoyment, part of enjoying the festive season, but sometimes it can be a sign that things are not going so well as well. So you might be feeling a bit upset, you might be feeling a bit low, a bit lonely. Various things can trigger people drinking. I mean, we were mentioning there about perhaps drinking to excess. What sort of things might have an impact on somebody's well-being to make them drink to an excess? You know, if you're
You're
living with
totally right.
diabetes.
You're
Yeah.
totally right, John. I think in as much as we talk about the festive periods, I think the Christmas festive period is probably one of the ones where people feel very lonely, very alone, no family around, they've lost loved ones, so they're going through different pressures. So in as much as a merry time for many, it's actually a sad time for a lot of people as well. And such of this low mood could lead to stress in the body that could increase the sugar levels in the body, that could also change behavior like drinking more in excess to try and drown your sorrow as it may be. So all of this sort of interlink as well, where you also have an impact on your sleep as well. So you get irregular sleep patterns or insufficient sleep or poor sleep patterns. All of this as well has an impact on your diabetes management, because it could worsen your sugar levels in your blood. So I think it's very, very important that as we talk about managing the alcohol as well, you're also managing your mind as well, being very mindful of your how you feel and speaking to people, speak to your diabetes specialist, to your GP, assess local services such as your talking therapy as well. They can actually help, be there for you, or assess local services that provide support like befriending services, so the social prescribing services. So there are things out there. So don't feel you're alone, but be mindful that things like this could actually have an impact on your drinking habit, but also more importantly on your emotional well-being.
Yeah, that's fantastic advice, because it's not a, as you say, a merry season for everybody, and we all have to be aware of that. So thanks very much, Charles. And is there any other points that you wanted to raise? Because we don't want people to think that we don't want them to enjoy themselves. It's about thriving and being healthy and being safe and being well. Anything else you'd like to share with us?
Yeah, so as we said, I think it's, as we earlier said, it's all about being mindful. It's all about making good decisions, being more aware of the consequences. So as we said, alcohol isn't bad in itself, but it is a drug, as we earlier said. It's all about the amount and the percentages. So it's all about drinking in moderation. The same with the eating as well. It's a festive period for many. So it's time to wine and dine with family. So that's fine in itself. But we normally recommend that you plan your festive period, plan the eating out, plan the drinking out, plan the food you're going to cook at home, especially if you're on insulin type 1 or you're on insulin producing drugs. You plan this thing so at least you can be prepared for it and be mindful of how to manage the situation from a day-to-day activity at home. Also, be more mindful of the fact that your behavior has changed. You're going to probably be less active, but you're going to be eating a bit more. So remember to keep moving a bit. Even if it's just going up the stairs, going for a walk, walking with the family, going to the park, whatever festive activities you plan in place, make sure it includes moving around so that you don't become too sedentary, which could actually worsen your diabetes as well. Also be mindful of acute illnesses, because again, we still have the flus and everything happening during this period. So remember to take your vaccinations, speak to your GP about that, speak to your local pharmacist about that, and be mindful of your sick day rules. They can always print you a leaflet so you have that at home for yourself and your family as well. Again, for some, Christmas season might be a baby boom season as well. So be mindful of that. Sex is a physical activity and can have an impact on your blood sugar. So do speak to your diabetes specialist, your GP, your pharmacist, and it's all about being mindful, checking your blood sugar levels and planning in advance, especially if you have if you're on insulin or you're on insulin producing drug.
That's wonderful advice, Charles. Thank you so much.
You're welcome.